Bringing our health correspondent, Nicola Hill. She joins us now. Nicola, it would seem obvious to me that this virus that moves on into the lungs would adversely affect smokers. But there are conflicting reports and articles online about the correlation between these two, no?
There are, aren't there? And I mean, like you, I would have thought automatically, smoking's bad for your health, therefore it's going to exacerbate your chances of either getting COVID-19 or being more seriously affected by the virus. And that is the case. That definitely is what the WHO and lung experts, respiratory experts are saying. But it has been confusing because there have been these studies, mainly coming from France, saying that the numbers of people who've been hospitalised with COVID-19 and who are smokers are much less than the general population. There was this study that came out saying that in France, where 25% of the population actually smoke, only 5% of those in hospital are smokers. So that's why there were a lot of headlines, there was a lot of discussion about this in the scientific community. Theories being put forward, perhaps the nicotine in some way might be protecting you, whatever. But I have to say, Dr. Nick Hopkinson, who is the chair of Action on Smoking and Health here in the UK, a respiratory specialist, says the evidence is accumulating to show that smoking definitely is not the right thing to do. It's like you were just saying, we know that people who smoke are at much higher risk of getting respiratory illnesses such as flu, pneumonia, bronchitis, and the evidence is showing that they seem to be much more vulnerable to COVID-19. There was a study done in China saying they're 14 times more likely to do that. So, asking Dr. Hopkinson, why was the theory that people might have been less likely to have it if they smoke? And his theory is a couple of things. He said one of the things is that when people go into hospital, you might have just given up smoking because of your health, because you weren't feeling well, so you class yourself as a former smoker. Also, some of the data gathering, you can imagine it's hectic with the hospitals being overwhelmed by numbers of people coming with COVID-19, so sometimes data gathering can be not as robust as it has been in the past. And he says, of course, not only is the danger that the toxic chemicals inside cigarettes, tar, all these other chemicals, what they do to the lining of the lungs, how they get into the blood system, and we know that they can cause heart attacks, they can cause strokes. The other problem with COVID-19 is people actually smoking. If you think they're bringing a cigarette to their mouth, they're using their hands, they're touching other elements, other surfaces, back to their mouth again. That, of course, is a way that we know people are contracting the disease. So he's quite certain, if you're a smoker, give it up, because the statistics are shocking. I mean, you just said then, 500,000 people have died of COVID-19. 8 million people a year die of smoking-related illnesses.
Okay, I think Dr. Nick Hopkinson may be onto something, but I'm wondering if there's any data out there to suggest anything about vaping, perhaps.
That's something that's certainly being studied at the moment. It's interesting. I was speaking to a lung expert just recently and said to them what impact is vaping doing, and all the studies and the conversations that people are having, is vaping as bad for your lungs as smoking? And she actually said, no, vaping is preferable to smoking. So if people are wanting to give up, vaping is preferable. It's not good for you, and never take it up. And we've had all the studies and all the reports about young teenagers thinking it's trendy and maybe they should start vaping. No, but obviously vaping is nicotine and it doesn't have all the toxic chemicals. But the studies about vaping and COVID-19 are being done at the moment.
All right, our health correspondent, Nicola Hill, thank you very much for joining us here on the NewsHour.